should look around.
It's all good. Hey everyone, thanks for joining us. My name's Luke Dam. I'm the CEO of SafetyWise, and this is a new episode of our podcast, Conversations for Change. This one's going to be a little bit different. Traditionally, I've talked to health and safety people, risk people, public safety, and so forth. And for this one, I want to talk a bit about health. So joining me today is Dr. Leisha Amos-Bickley. She's my chiropractor, and don't switch off when we say chiropractors. We're going to talk about chiropractors and the goods and the bads and the reputations and everything else that comes with it. Thank you. Thanks for joining us.
Thank you for asking me.
No worries. So let's talk a little bit about you and your background. What do you do? That's broad, isn't it?
Well, I help people be well, actually. And so that is much broader than what people think. Much like when I got my coffee this afternoon and the guy said, "What do you do?" And I said, "I'm a chiropractor." And he goes, "Oh, you're a backcracker." And I went, "No, you haven't never been to a chiropractor." I said, "You haven't been to one, have you?" And he said, "No." So essentially, I help people be well by helping their body function better, particularly in a movement sense. Yeah, go on.
Okay, so let's pick up on what he said, because I was no different. So I've been seeing you now, I think 4 months, 5 months. I've lost 4. I'm going to say 4. I've actually lost track. 4 months. And do you remember what I said the very first time we met in your consult room?
I've got the ailments of an 83-year-old. And I said, please list them down because you won't believe how much you're going to change. You think you're coming to me for neck pain or shoulder pain, whatever the pain in the frame is. Everyone thinks they're coming in for pain. And I say, good, let's talk about that. But you've got a delicate nervous system attached to your frame. And so when we start moving the frame, we have an effect on the nervous system. That's when the magic happens.
It does. I'll attest to that. So I actually said to you that in one of my opening statements, I said, I've got a big fear of chiropractors. I hate the term chiropractors. And I think they've got a terrible reputation. And I think as a profession, I think they've got a real identity crisis because, and I think your barista sums it up beautifully.
Absolutely.
You crack backs.
Yeah.
And yet, how many times have you cracked my back?
Never.
Yeah. How many times have you cracked my neck?
Never.
How many times have you cracked my hip or any other part of the body?
I've cracked nothing.
Nothing. Not a single
No cracking.
Yeah, absolutely. No cracking. And I didn't expect that. So that was a big mind shift. And I won't lie, I will say, Leisha goes a million miles an hour, but I love that. I love the passion. I love the energy. But she's telling me all about what she does and how she does it. And I'm going,
And sometimes I said, I don't think you want to be here.
And I must admit, I had to go home and sort of digest it. And I probably did what everyone did and did the Dr. Google thing a little bit. And you're like, okay, maybe she might be onto something. And I'll talk as we progress through this about my journey because chalk and cheese from where I was 4 months ago to where I was now.
Totally.
Let's talk about that reputation issue and that identity crisis.
See that deep breath?
You're a bone cracker.
And it is because I've worked on it for years, trying to work out how to manage that. And I ask really great clients too to say, if you're referring me to somebody, perhaps don't open with that statement because they feel that they know everything. They feel they know everything what chiropractic is, what it does, because their great-grandmother or whoever had a bad experience and that's it. And then they've shut off. So I still haven't got it pegged how to say it. So sometimes I ask people to say, tell them I release where your nerves are getting caught. And usually then they'll ask a few more questions. And once you get the person talking about themselves and talking about their well-being and the problems they have, I can then link it back. And I feel that I have their trust before we open with the word that they feel that they know all about, but they don't really. But how we've developed that reputation, I don't know if we developed it all entirely ourselves. I think there's been help to work at discrediting chiropractors. We do have
there's lots of horrors. Oh, these people are paralysed. This happens. Oh, it doesn't work.
And we have a 5-year university degree. And when you really trace down a lot of those so-called injuries, a lot of them weren't done by chiropractors, but they gain a lot of momentum and then they don't get a clause in the paper the next day. So, well, that really actually wasn't a chiropractor. It was a masseur or it was this or it was that. And it just sort of, and people love to have, a great story, they think, or they love bad stories.
Yeah, absolutely. I'm going to digress just a little bit, but it'll tie in.
Yeah.
Social media, I think, is actually causing more issues. And I don't know whether you've seen them. I'm going to assume you have. There's and I'm going to call them chiropractors because I've got no way of discrediting them or anything else.
That's right.
And they love to put people on their beds. They love to mic them all up, and it's literally who can do the loudest cracks.
I know.
And is that helping or is that harming?
It's not.
You haven't cracked any bones yet. I'm waiting for this big crack to happen.
It's not helping. Okay, so it's not helping. I know in the politicians' world they say all publicity is good publicity, but I'm not quite sure. So there is that hurdle to get over first. Look, they're not harming the person. Those popping noises are not harming, for a start. And there's many different techniques within the chiropractic world. So I'm not saying that they're doing harm. I just don't think that is helpful if someone's feeling any trepidation at all to go to someone that there's a lot of hurdles to get over by the time you go to a chiropractor, because they think physio and chiropractic's the same. They go, I'll go to a masseur instead. I have acupuncture instead. And then my GP's not so sure, so whatever. So there tends to be all these things to get over first before you go, and then to see something like, oh, no, I just won't. And then on top of that, because they feel there's many things that are very similar, physio is the same, osteopathy is the same, acupuncture is the same, they'll say things like, I'm already doing something like that. So if you said to someone, you should go and see Leisha, I go, oh no, I'm already doing something like that. And so because that's all the same, they think they're already doing something, so why would I go and do something else I'm not sure about? I think I'm already doing something very similar. So I think I actually said to you, we might have been a week in or 2 weeks in, I go, am I like what you thought I was going to be like? Not a thing. Yeah.
Not even remotely close to what I expected.
That's right.
Not even close.
Yeah.
But I will say, let me go back, and I'll quickly, for everyone's benefit. So I had stomach surgery about 5 years ago, 2021, I think it was, from memory. And they discovered through that process, it's the first time I had major surgery, and I've got an airway alert as a result of that. I've got a compromised airway. It's a narrow airway. And when the anaesthetist had to do the tubing and so forth, she had a hell of a time. So she ended up putting together a 2-page airway alert. Fast forward, I had some surgery. I had a cancer scare in 2023. They had to go down through my neck and behind my lungs. So part of that process, they put me under general anaesthetic. They also paralysed me. So I couldn't move. They said, if you move, you're in a world of grief because we're behind the lungs and so forth. But what they did, because of my compromised airways, is they basically, what feels like, they hoiked my neck back and put me on some weird angle. And I couldn't even tell you how long I was in surgery for, but for whatever that period of time was, I was. And I came out of this thing, and fast forward to late last year, I had days where I couldn't move my neck. Like the pain was just off the chart sometimes. And to go through what you said, so I tried massage initially, good for a day or two. I then tried acupuncture, didn't feel I got any result from that. I then went to a myotherapist and also did dry needling as part of that process, and I'd be good for a week or two, but then it was straight back. And it was someone I worked with, Danny, my business partner, and who'd said to me, she said, maybe you need to look at a chiropractor. And I went, oh, cracking, ooh, that stuff's scary. And it took me months. Yeah, it took me months. And I've already got this sore neck and compromised neck, and I'm thinking, nah, this scares me. Yeah. And the good old algorithm, you start searching chiropractor, and suddenly your Facebook feed's filling up with bone cracking, and we're pulling necks with tourniquet, what look like tourniquets, and we're doing all sorts of creepy stuff. And I'm going, well, the first thing I saw it changing was my digestion. My digestion changed.
So how'd you choose me? So we got yes. So
I did. I literally did the Dr. Google like everyone does.
Yeah.
And I was looking for local, and I literally looked at some reviews, and then came across your clinic and did a bit more searching around and researching, and went, I've got to do something. And then, I won't lie, there was an element that it was convenient in terms of location and so forth as well for where I was at the time. I was working here in the studio area here, and it's up the road. It was, so that wasn't, I won't lie, that was part of the deciding factor. And like I said, I sat in that first consult and thought, what is this white man magic this lady's talking about at 1 million miles an hour? But fast forward, like within days, you talked about the vagus nerve. Like, this is central to everything you talk about. What is it? What's it do? Why is it so important? And is it some sort of white man magic? Why don't we hear more about this? Because until you'd even said it, I'd never heard it.
Well, it is everywhere a little bit more now. So on mainstream. I don't do any social media or Facebook, whatever, but my kids say, Mum, it's
I envy that, I think.
So it has been, it's not a new thing. It's part of our anatomy. It's the longest cranial nerve. It's not new. We haven't just grown it. In the last 10 years, it's been there forever and a day. In actual fact, I'll go back to where chiropractic started and just put that as a memory, how we can link that back to the vagus nerve. Medicine has been trying to get the benefits out of stimulating the vagus nerve for some time. They found the most benefits with rheumatoid arthritis. And so they've been, because it has a role to play with dampening inflammation. So they found when they put stimulate somewhere, they've evolved into how they stimulate it, but then now they don't know how much to stimulate, how little to stimulate. They've known that the vagus nerve can dampen people with rheumatoid arthritis they can't control any other way. Also seizures, they haven't been able to control. So it has been in the medical world as something to go to as a last resort, perhaps. My sister's been a nurse for 50 years, and she said it's something they will massage. They know how to do it if people have fainting episodes, things like that. So it's not new. It's been talked about, but it's probably not at the forefront. Speed forward. Early days of chiropractors, there were practitioners called the hole-in-one practitioners. It's probably not great when we're we'll get back to that later. But they're upper cervicals, so the base of the skull and that top vertebrae. And when I graduated 30 years ago, there was a technique that we did, and we only adjusted that top vertebrae. Now that vagus nerve wraps around the front of that top vertebrae. However, we weren't being taught specifically about the vagus nerve 35 years ago. It was talked about as being one of the cranial nerves and in a simple form what it does. Now, research is saying it's easy to say what it doesn't do and what it's not involved in as to what it is involved in. Right down to memory formation, inflammation. It just controls a lot of the feedback. 80% of its role is feedback from the body back to the brain. So the brain's getting a better feedback of what is going on down there. We tend to think of the brain talking to the body from up down, but it gets its information so it knows what to do from back here, and vagus nerve is primarily doing a lot of the gut. 80% of it is feedback. Why have we not heard about it so much? I believe mainstream medicine, its focus is more on a chemical way or a pharmaceutical way to manage things. And so some of these older things that used to happen, like my sister's been a nurse for 50 years, said, we knew how to stimulate this if someone was fainting, or do that, or brown paper bag, or things like that, which again is a parasympathetic thing, which is vagus. They now will go straight for a pharmaceutical answer to things. And I had a discussion with a dentist about this. I'm enjoying a very nice glass of red once about this. And he was very interested in the work that I do with the TMJ, tempera mandibular, your jaw. And he was one of the head teachers of dentistry at La Trobe here in Bendigo. And he said, it's fascinating, that all does link together. And I was saying how the head position's not right, the jaw will swing the other way. And so, do. And he was expressing frustration that they won't teach enough of that now. They will do it all pharmaceutically. He said, if someone's got jaw pain, an anti-inflammatory or a muscle relaxant or whatever. And it was interesting how his personal point of view was the dentists want to be accepted or want to do a modality or treat in a way that the GP likes. The GP likes to do a treatment that marries in with what perhaps the surgeon likes, so that they're happy and comfortable with a pharmaceutical answer. Doesn't mean it's wrong. There's just other ways perhaps leading into that. And I believe, and as a profession, we believe that we do less invasive first. So, if we can get relief by, loosening up a joint and helping them perhaps put just sleeping in a different position, sleeping on a different pillow that's going to help that settle better, we think that's less invasive. And if that doesn't work, or then we can add in on top of that maybe some magnesium to help for muscle relaxants, rather herb rather than, and just gradually coming less invasive into the system.
What? So surely you're not the only chiropractor doing this.
No, I'm not.
But that's not what we hear. We hear bone cracking. That's what you do.
Chiropractors.
Why do we hear that and we don't hear about this? I'd never even heard of it.
Why don't we? We are not good at selling what we do. I don't know why. Having said
Let's
that,
go back a step. She did say, I don't do social media. I don't do
oh,
it.
there we go. There we go.
go.
That's what.
I know how to fix that.
And we are so, our people love us. So most of us aren't looking for work. I think that comes back to it too. And we love looking after, we truly love our people. I said to that coffee, that guy said, you're a bone cruncher. And then I started talking about what I do. And he just said, here, write your name down, whatever. And I just went, and I just kept talking. He said, write your name down. I just kept talking. And I said, I'm married to my people. I like them, but I'm highly involved. And I think most chiropractors are. We truly love what we do. And we walk our talk. And I mean, I've been adjusted twice a day. It's what I do. My family, my husband and my son are adjusted every day after our walk. And we live it, we breathe it, and it changes your outlook on what you think health is. It's not disease management. It's managing the body to be at best it can be, so we can minimize the time we have to come back for the medicine to take care of us. And medicine does a wonderful job. And I've had 2 children saved through the Royal Children's Hospital. So I am...
So medicine has its place. But
totally.
Yeah.
We can't...
You're not anti-medicine. Not anti...
No. I'll say again, they've saved 2 of my children's lives, and also got in a bit of strife having my first child that could have gone pear-shaped. So we're all got a role to play, and it's also what I talk about with new clients. I say, your physio's right, your myotherapist is right, and also your Pilates instructor is going to have a whole lot better job at helping you through that if we can get your blue triangle and green triangle balanced. Back to which is our pelvis and our rib cage, and I say that because Luke knows all about his triangles.
Yeah, absolutely.
So
So just to recap, I turned up for this neck issue. The first thing I saw a change in was my digestion system. I can't talk. System. Won't do visuals, but I saw changes and improvement within 2 to 3 days, and I didn't expect that. I went there for a neck. Now I'm going to test your memory. Do you remember, we did an assessment Monday, but do you remember what my neck movement was on day 1? It was something like 5.
Less than 10.
And what was it on Monday? Do you remember? It was
50.
Yeah, it was way up.
Yeah, way up.
So I've literally gone from not being able to do that to look at me, I'm doing it, and I've got no discomfort, nothing. I saw other changes. I have very minor psoriasis. It's through my family. My brother has it. My mum has it. I saw changes within weeks. It's settled right down. Hasn't gone. It's definitely settled down.
And I postulate 2 reasons for that, because I could hear people out there going, how can your bones have anything to do with that?
Go.
So,
Here we go. Hang on, because I'm telling you, this is fascinating.
So we have a skeletal frame. I'll just have to say what I said to the coffee man today. So we have a skeletal frame, and people usually come into a chiropractor for pain somewhere in their frame. I got a sore shoulder, I got a sore neck, I got some sore somewhere. Now we call that pain in the frame. I call it in your triangles. You got a blue triangle, a green triangle, and a yellow one. Okay, just to keep it really simple. What is attached to our frame is our nervous system, okay? So it has to. So the reason we have a spinal cord, or a physical spinal column, is because it's holding the spinal cord in place, and our frame is only there to anchor stuff to it. Now our stuff might be our colon, our stuff might be our bowel, all this sort of stuff. If it wasn't attached to our frame, it'd fall right down, okay? If our brain wasn't attached to the inside of our skull, which is part of our frame, it'd all fall down, okay, because of our gravity. So it's all attached to our frame. Okay, so when we move through life, we're made up of all moving parts, okay? Now, hips are moving, you know the old song, the hip bone's connected to So we're all connected. So we're moving.
She'll sing it at the end.
We're ambulating through life. And I say, so it should spring. So our joints are meant to spring, okay? And going through that spring process, just like your shock absorbers in your bike or your car, they hit potholes of life, okay? Now, with that, we can have a good jolt. We might bounce back out of it. But once that's happened 50 times or whatever, by the time you're even 5, you're falling off your bike, you're falling on your head, you're falling off the horse, you fall out of a tree. Some of those springs don't boing back, okay? So we might just go, oh, okay, that's okay, it feels all right. Sore for a couple of days and it was all right. That may have made our blue triangle tilt a little bit or not move quite so much on one side or the other. I'll try and get to the point quickly. When we have that happening in lots of different places, we can start getting to an image I call the wonky body. So we walk a certain way. Go and watch 10 people walk and you'll go, oh, Yeah, I can see that.
One leg for me was shorter than the other, and I didn't even know.
Yeah,
And I didn't present for that. I presented for a bad neck.
But that's a presentation of the wonkiness in your blue triangle. Yep. Some people, they can see it in their shoulders. They go, yeah, I know. I go, well, that's your green triangle, but it's doing that because of this down here. And that's connected to that. Anyway, so all those moving parts are interconnected like cogs in an old watch. So we can get changes because of the interconnectedness of all those moving parts. Sometimes releasing the pelvis on the right side can release the neck up on the left, which is why you can get amazing changes and you feel like I didn't do much to your neck. And vice versa, either end. So we're all tethered together and you've got to find the order to unwind them or untangle them.
Yeah, absolutely.
And it's not forceful.
No. So digestion changed, psoriasis changed. My neck is off the charts. Like, I'm just blown away by that. Like, I don't even give it thought now. I don't have that discomfort. And even simple things, those who know me, I ride my trike everywhere, and simple things like looking over my shoulder, trying to make sure blind spots are clear, some days was painful. Or I'd do it and go, oh, that hurt. Oh, hell, gone. I've noticed changes in concentration. Call it a coincidence, but I've got really active with the social media stuff over the last 4 or 5 months. Gee, that ties in with...
I had a CEO
There's
say
so many things that I've noticed changes. I came for a sore neck. And I'm going, holy shit. We're onto something here.
I'd say that's also the vagus nerve. So going back to chiropractic in its early days, they knew, we call them the grandfathers, they said if you have the upper neck and the base of the skull moving well, you'll transform that person's life. They didn't know why. They just said it's the life, they used to call it the life force. And see, when we talk like that, sometimes but and now we're knowing there's a lot of nerve endings up there. It's actually the brain extends down via the brainstem from about past C2. So the brain is actually in the top part of your neck. I mean, we know that the spinal cord, but actually brain comes down in there. So that's actually one of the very most important part. And we have a lot of areas that are the control centers for heart rate rhythm, breathing rate rhythm, digestion. The brainstem is the part of the baby's nervous system that's only just functioning when they're born. That's why they can sleep, poop, and eat, and that's about it. And then the rest of the brain develops from that. So the brainstem is where it's all at. So injuries to the upper neck, stiffness to the upper neck has the potential to profoundly affect someone's function.
All right, so let's go right back to the start. Why chiropractic? What made you choose that?
I didn't. I was going to be a medical practitioner. You'd probably never know that.
No. And what happened?
So
that's a big shift.
So my mum said to me, I'm from Gornong, little country girl, hanging the washing out on the old Hills hoist. I was 5. I was going to school the next year. Mum said, what do you want to do when for work? And I actually said, I want to help people be well. Oh, so Mum said, you want to be a doctor then? I said, I guess so. But that's it. That's an interesting thing. Like, I always thought I was going to help people be well, not treat sickness. So do with that what you like. And so then I thought, okay, I naturally seem to find schooling reasonably straightforward. So I was considered one of the smart kids at Gornong Primary School. They're 65, so it wasn't hard. Anyway.
The benchmark is...
And then I went to... but all that time I was interested in health. I went through the stage of thinking I'm interested in nutrition. Mum worked for a naturopath, so that was sort of coming into the home as well, natural ways to be well and to look for why you're not well, thinking it might be something you're doing rather than the body doing something wrong. There's another key difference between the way our profession thinks what the body's doing versus mainstream a little bit, but we might talk about that later. So I grew up with the belief that look after your body, and if you're showing a symptom, it may be for a reason, that's something we can manage, or you've eaten something wrong or something like that. So I grew up sort of thinking like that. And then I got an interest in bones somehow, which is chiropractic's not bones, but I did get interested in bones. My dad had very, very sore neck, and he started seeing a chiropractor, which was fantastic. I still had no idea what chiropractor was. So I then thought I'm going to be an orthopedic surgeon. I was going to be a dietitian. I was going to specialise from medicine and do those. That's what I was going to do. So then we fast forward to Bendigo High, doing year 11 and year 12, and you had a compulsory time with a careers person. And so I was just talking like this and, why medicine? And I said, I want people to be well. And I was saying, I think the body knows how to be well. and we need to take away the things that are making it sick rather than thinking the body is sick itself. We might behave treating it not right. And I also said in that interview with them, and I remember it because it led to the thing that he said to me, when I said, I also don't believe the body was born to need medication to be well. And he said,
that's pretty profound for what, year 11, year 12?
Oh, there's a story before that actually. And he said, oh, you might struggle in medicine. And I went, well, okay then. But I hadn't, because you're either an accountant, a doctor, or a lawyer. When I was, I'm pretty old, so back, and it was just like, that's what you did. If you had pretty good at school, that's what you did. And I thought, well, I'm not interested in any of those other things, so that's what you did. You did medicine. And a boyfriend at the time, his family, and my dad had been going to the chiropractor, but their family were really into chiropractors. And that sort of opened my world to what chiropractic was. But I didn't have much of an idea before that. But going back to, you said, interesting for a year 11 person, say, when I was 14, I also had a lot of ear infections from about 12, something like that. So I was the person with the plugs in the ears when you're swimming and the whole whatever. And, I would have been about 14, and I said, I'm having another ear infection, toddle up to the GP in Elmore. And so here I'm at 14 saying, why am I getting these ear infections? And he said, well, some people just do, and some kids just do, and you'll grow out of it. And I said, what if I don't take these antibiotics? Because certainly they're not stopping me from getting them. I said, what's going to happen if I don't take these antibiotics? Mum's kicking me under the table, saying, you're showing disrespect asking questions. And he said, well, it might last, you might have a bit more pain, it might last a few more days more, but why don't you probably get over it? And I went, oh, okay. So that sparked a little, I went, okay. So we're going home in the car, and I said, I'm not taking these antibiotics, Mum. Not happy. Mum's not happy. Oh, you always got a different opinion. Anyway, so I don't know how this might be a fairly gross story, but so yes, I did get a lot of pain. It was very uncomfortable, but I had this theory that something's wrong in there. All right. So
it doesn't just happen.
No, in my mind I'm going, it doesn't just happen. I said this, so I thought there's a reason, which is similar to why chiropractors are why. So then I let it all develop overnight. I had a very painful night, etc. I also wouldn't take Panadol, so a very painful night. And then the eardrum burst. Now, the eardrum is a membrane, okay? So it just lifted because there was a build-up of stuff behind that. That all ended up out on the pillow, pretty gross. But I never got another ear infection after that. So I went, right. So that's within another thing going, well, that, in my mind, confirmed the body knows what it's doing if you let it do it. So the antibiotics would have been drying that up in that. This was my theory anyway at 14. And so all these things were just leading me towards... so as chiropractors, we sort of feel sometimes we were chosen to do it, and there's a line of things that line up, and that's so. I was always questioning why. Why do we get sick? What's going on?
That's important, though, isn't it? In work, like day to day, like it's important to question things.
Totally,
absolutely. I don't think we do it enough. Ironically, I shared a post on social media yesterday for work, and it was talking about. Why people do what they do. Because I was trained to. But do you understand why? No, we're just trained to do that. So when it deviates from what you're trained, how do you make an informed decision? You've got to ask these whys. You've got to have this. It's interesting you say that. All right. So 30 years ago, became qualified.
31 and a half now.
31
I keep
and a
saying
half.
30, but
30 is okay. 31 and a half.
Yeah.
And you made a comment very early on. You weren't taught about or very little about the vagus nerve. So your bone crunching. No, what were you doing? And what's changed? How did you discover this vagus nerve thing?
No, well, we link it together now because we always knew about it. So it's one of the cranial nerves. It's not whatever. So you start to link together, like keep watching, keep asking. We knew when the upper neck was right, things were better. So when people, like you said, your digestion was your first thing that you didn't, first thing you noticed improvement with came in for your neck, but my digestion is better. So when you have so many new people and then you start asking them in 6 weeks, fill in this form about your digestion, about your mood, about your anxiety, about your bladder control, whatever. And I haven't told them what to write down. I said, I want you to fill in now in 6 weeks, 12 weeks. So when that improves consistently and they're looking at it and they're going, I came in for my left hip pain and my right shoulder, how come this is written? I go, well, your nervous system's attached to that. So there are multiple actually areas to the nervous system as well. We don't know if it's entirely all the vagus nerve as well. So I say it's most likely that. All right. So it makes more sense as to why someone who's had an irregular heartbeat for 10 years after 2 weeks of chiropractic care has noticed them dramatically reduced. Under no circumstance do they stop taking their medications or anything like that. They come back and say, I feel better, or I haven't got this irritated cough in the back of my throat. The best way at this time that we can explain it is because of the impact on the vagus nerve, which runs through the carotid sheath, which runs with other, an artery and a vein and a nerve as well. But that when if the head's been stuck, it's pulling on that carotid sheath. So when we get that moving better, we can hypothesize that it's the vagus nerve. And physios are talking about it. This is not just a chiropractic thing. There's research. If you go and Google upper neck dysfunction, vagus nerve function, you will get inundated with info. It's there. Yeah.
What's a typical day look like for you?
Right from the start.
Why not?
Alarms at 5. We actually don't need an alarm. We have 2 beautiful greyhounds. 5:30. Yeah. And we're up at 5:30. My 14-year-old son is just passionate about life. So we all get up, we walk the dog, he goes to the gym, get a single shot espresso with hot water on the side at 6:45 and sit and have a chat. That's probably the most conversation I have with my husband for the day. And it's the best part of the day, that walk, and the sun's coming up and it's beautiful. And we walk up through Rosalind Park. And then I feed the dogs, he goes down and fix up Blake, and then come back, they all have an adjustment. And then I sit down and do my files in preparation for when I start adjusting people at 12:30. And I adjust straight through till 6:37. So I do 6 hours straight and love every minute of it.
I've noticed that.
Yeah.
There's a little bit of passion that comes out.
Yes.
Just a little bit.
Yeah.
I lost my train of thought there. Has your opinion changed over the years? One, on the chiropractic and the profession and what you do, and obviously I think you've really answered this, and obviously medicine as well. It clearly has changed.
The way we do it has changed. Yeah. There's many different ways of doing chiropractic. So there are people who work a little bit more like me, and then there's many different techniques for a start. Most of us, there are a group of chiros that work very much like physios. Okay, so they'll work and rub and the sore spot. So that's okay. I have some great friends, best friends, that's the way they work, and they work with sports people, and that's what they love. And they have strong relationships with orthopedic surgeons, and they love that part of their world. And they do a great job of that. And then there's another group of us that work more with wellness, and people that haven't got sick, but they're just not doing life great. And we say, how well can we do that? So something that's changed in me is I have a lot of medical friends, and I stopped trying to sell them chiropractic. The whole let them thing, which I actually didn't even know was a thing. So I had a patient tell me when I said, just let them. So, she was trying to get someone to come and see me. She goes, I'm getting so much resistance. I go, just let them. Stop. She goes, I like the book. I went, I don't know what the book, but the whole let them thing. So when you stop trying to sell something and just do and say, if you want me to help you, I'll help you. If you want me to explain it, I'll explain it. If it's not what you want, that's okay. So you do what you do, great. If you come against someone you can't help and you think, I could, happy to do it. But not putting them down, we're all doing the best we can. And I think we all have a great place to all work together. And because there's certainly things they do that I can't do. But I think there could be more people helped when the other things, because chiropractic is not the same as physio or massage or acupuncture or whatever. And as soon as we realize that's not the case, we can be put in the selection of things to do when we don't need surgery, when we don't want to take the anti-inflammatories anymore, when all those things, when someone's at a loss, like you were, if they know that chiropractic's not the same, we can be put on the choice section. But because often it's considered the same, I think that's a key. If they knew that it was not the same, well, I'll try that now that I haven't tried that. But they think they have because they've done physio and massage.
Yeah. All right, so let's fast forward into that day. We'll use mine as the example. Typical session. I lay down, wait for you. You breeze in at 4 million miles an hour.
Yeah.
I told you she's fast and passionate. And there's been some days you've literally walked into stop and go, well, the energy, dude, it's way off.
Yeah. What do I see? What do I feel?
Yeah.
Well, the wonky body you can see on the table. So when I said about your pelvis and your ribs and your head, so sometimes I walk in and I go, that does not look anything like what it was last time.
So literally it's sitting strangely is what you're saying?
Your feet can sometimes be sitting crooked. Sometimes I prefer to say what I see rather than what I feel because people get a bit, they don't understand that, or not as comfortable. They don't hear that so much. But because you get to know your people so well, as soon as I can actually put my hands on your calves, I can feel the difference. So the tension in your body is highly represented in your calves and feet.
So you're talking like muscle tension you can feel?
Yeah. That's it. And why that is reflected. So the tighter our spinal spring gets, the wonkier we get, the more it's pulling on the nerves, it actually shortens that calf muscle, which is why so many people get plantar fasciitis, pulling in their hamstrings and tight calves, because it's actually coming from the tightness in the system from being wonky. It's one of the first things people notice as well when we start releasing the blue triangle, the pelvis, releasing it, untangling it. They go, oh gosh, my feet aren't aching anymore. Okay, because it's not a separate problem; it's all hooked together, like pins and needles in your hands when you start releasing through here. Yeah.
So you come in, you do the touch, you do. I can't. We should video one day.
I have got it on my
you literally
website.
Touch, move this, wedge this, put like this. You've got a click. I'm going to call it the clicky clack thing.
Yeah.
What is that, and what are you doing? What are you using that for?
Okay. Well, it's a spring-loaded instrument.
Yep.
And so where we feel the joint being restricted, you just get it and you go, it's moving well that way and not that way. Sometimes I'll do it with my hand, and sometimes I help this instrument to help me. And it's the speed of this instrument that talks to the nervous system. It's the only time I've ever used year 12 maths, or maybe not chemistry and maybe in uni, but the impulse of the instrument is in a sine curve. And it has the same frequency of the way energy travels along a nerve.
So it's like a spring.
I should have. Yeah, you told me to.
Like a spring-loaded punch sort of thing. It sort of spring-loaded punches, delivers.
But it's not like that, does it? You can hardly feel it. Yeah.
No.
So it's a. People go and I do it and they go, that's not going to do anything. It's the speed, not the amplitude of it. It's the speed of the. Yeah.
Yeah. Okay.
Yeah.
Yeah.
And it was designed for newborns and the elderly and people post-surgery. So that's actually how it came into being used in routine practice, so that people who had compromised frames or had post-surgery or had osteoporosis or had issues that we had to take into account could get the benefits of having the nerve tension released.
Yeah.
So we release nerve tension by getting that area to move better. And sometimes we do it with our hands and sometimes we do it with an instrument.
Yeah. You'll sometimes put blocks under my body, different locations, and then leave me to chill for a few minutes. What's that doing?
What's that doing? Many things. So the blocks will be put in an area that's all our different techniques, and there's many, many years of experience to actually bring ease back to the nervous system. So if you imagine your body was being tethered like that, and then I put a block there, when I feel there's indicators to take when the nervous system's at ease. So you do everything to bring the nervous system back to ease. They have the feet relaxed, has the pelvis settled down, have the calves settled down, then we know it's at ease. But there's many indicators, and everyone's a different chess game, which is like the way I like to describe it, because also when I make one move, there's 1,000 different there's many different options after that of which way the body could release. And so from that, and then you move through chapters of care as well.
And there has been a few times you've politely said, "Shut up! I'm concentrating." Yeah. What are you concentrating on? What are you listening to? What are you doing?
It's a distraction. It's an unnecessary. Well, it also distracts you and it distracts me. So I'm feeling, and it's a feel. It's not an observation. It's a feel. And now I tell people on the second visit, I'm not going to talk much about the weather. I'm not going to talk about whatever. I really need to concentrate. When you're untangling the system, because all those cogs are all interconnected, I'll do one release and I could get a ripple of 10 that I need to follow. But I don't need to check all of them, but I've got to watch what they all do. So I'm watching, I go, no, touch, and I go, not that one, touch that one, it's not that one. And so you're
looking for a physical change is what?
So I know that when that changes, I know it's linked with many other ones. So I'm also sort of watching, and I can run my hand up and feel which way it's gone. And I can feel if it's complete or not. And then sometimes it builds up rather than settles down. And we go, okay, we take that out. And so I'd rather them be concentrating, and I'd rather say, I want you to breathe into this spot, release through here, tell me if pain develops. So I want them to be concentrating on the beautiful stuff that's going on in their body, relaxing and releasing, rather than it's not, what we're doing is complicated. Yeah, it doesn't feel like it. The nervous system.
You make it look easy.
Yeah. But if you do reflexes, the good old one when you hit your knee, you don't need to hit that very hard. What you're doing is making a nerve respond. So I'm making nerves respond right throughout your body, and it's all about accuracy and the order with which to do it. So you don't want to be tuned out, you have to be completely tuned in. So you get better results that way. So now I tell them the second visit, there won't be much talking. If you have any questions, please email me then. I can do them when I'm out of adjusting mode.
Yeah. Okay. Was there any mistakes you made really early on in your career? You went, cool, learn from that?
Yeah.
What was it?
So frequency of care. Now, so chiropractors, there we go, when you said we have, what do you call it, a brand problem? Yeah. I think we also sometimes are too scared to say in actual fact what we need to do to get the person well. I've been through that. I'm very different my second 15 years than I was my first 15 years. My first 15 years, I was probably sat right within safe. Your hips are clear now, whatever. I now know I was nowhere near. If you had seen me 10 years ago, I wouldn't have been able to do for you what I have now because of my confidence, faith and belief that we need that intensity to do it. And that's when I get the different changes. So now that's why everyone does that initially 6 weeks, because that's when they go, whoa, this has changed now. And I go, I know you came in for hip pain. It's good that that's not there anymore, isn't it? But isn't this the wow factor? And so that's when I say, that's when they understand it's about their nervous system. Because if they're sleeping through the night for the first time in 10 years, I'll say to them, do you reckon that's about bones? Or when they say, like you did about what happened to your stools after the first adjustment or second adjustment, do you reckon that's about bones? So when you show them the impact it has on the internal functioning, you don't need to try and explain to them it's about the nerve. They already know it because they've experienced it. So that's the big change for me, that I so know what it can do that I now just say, this is what I do.
Was there something that triggered that change? Was it just an epiphany moment?
No. As you go to more and more seminars and develop more and more skill and start seeing things happen, going, I reckon it's to do with that. And then you go down that rabbit hole. Then you go down that rabbit hole and go, I really think it's that. And then you start talking to more experienced peers now and say, those seminars, the ones that I go to in Europe now. And you start talking to other people who've been practicing for 30, 40 and 50 years. What do you reckon when you do that? And you start, you just know that they can't get anywhere else what you can give them. And when you see them change, people are so grateful. And they just say, you've given me my life back.
Yeah,
and
absolutely.
And then when people go, oh, well, that's a whole week, you go, okay, keep doing what you want to do, right, next. And that's what my husband used to say to me. I used to come and go, oh, I could really, because if they don't want it, just go next. Do what you can and move on. I used to say, but I can. But now I go, right, okay, right. And again, stop trying to sell it. Stop trying to convince people. Let me show you. And if you're not up for it, okay, so be it. Yeah.
So let's talk about your junkets. Sorry, your professional development,
which only started in 23.
Now, can I just clarify? I've now banned Leisha from doing professional development because it seems every time she goes away, something else will just trigger in my body, and she'll come back, and I'm going, oh, what did you go away for? How important is PD in your role now?
Even more important than it was when I was 10 years out. Okay,
yep.
So it becomes increasingly important because you never ever know everything. And the more you know, the more important it is for you to be even better. Why is that? Because you're the leader. You're the leader in your profession. You're the leader to your people coming through. Chiropractors nurture their new ones coming through like little chicks. We pay for them to go to seminars as well. We even personally fund institutes, colleges, because we want to keep it alive. It's not a branch of anything else. We want our philosophy alive. We want it to stay alive. And we have a responsibility to chiropractic to pass on what we received, to leave the legacy that our grandfathers left us. Earlier, chiropractors went to jail for practicing chiropractic. They believed in it so much. They were put in jail for practicing medicine without a license. And they continued, they fought so hard, they had to go through so much more than we did. Now we're, fully registered. We have all the rights of all allied health practitioners. And we had people that had to fight for that. And so we have a duty to be the best we can be.
Let's talk that legacy word for a minute. I believe your 2 adult children have followed your footsteps.
Absolutely, yes.
Was there a moment where you said, oh, don't do that?
Never. I did. There was a time, though, that I got a bit disgruntled with, oh, you're a bone cruncher, and a little bit of the, not so much of the prestige that goes along with what we do, but that was part of the flick too in me. There was a switch that went in me going, when I was perhaps even trying to educate my medical friends. And so when the switch was when I stopped trying to sell it, and then looked at the beautiful thing that I do every day, and just helping my tribe, and that you want to change the world, change the person in the mirror, sort of thing. So, when I just focus on what I do and where that goes and where that goes and where that goes. So, there has been times certainly you couldn't be a chiropractor and not have a thick skin.
Absolutely.
Yeah.
Do you think there's a skill, an underlying skill that you've had to learn that's just really important for your role? Like, is it communicating, or is it doctor's handwriting? No. I mean, it's more to it than just. It's more to it than just
loving people.
Yeah.
Loving people.
Yeah.
I just love people. I love the human experience. I love all its messiness about it. I don't shy away from that at all. So I think being comfortable with just the human experience and being comfortable to say to people, everyone's got stuff. And that there's a connection. Chiropractors have a connection because they're dealing also with the nervous system. The nervous system carries emotions. So even that too, when you feel their body go, what's going on? Because the fact that our emotions travel on the nerves, so that's what it is. So, but having said that, you can still be, that's why there are different forms of chiropractic as well. So those who are a little bit more musculoskeletal, who work with orthopedic surgeons, et cetera, they might not be as much people either. They may be a little bit more like, I like the facts, I like the this, I like to look at the MRIs and I like to do that.
Yeah.
So, and I think certainly my closest girlfriend, she doesn't even call herself a chiropractor because she hates the thing that goes along with it.
Yep.
She, calls herself the spine person or something because of that hiccup to get people over that. And so she's rebranded away from the word chiropractor because of that. So certainly there has been times where you just think, jeepers, if only I said I help people breathe, they might go, okay, you want to go? Yeah. I've had so many people say, "Stop calling yourself a chiropractor," but that's like, it's like.
But it is what it is.
Yeah.
You are what you are. Yeah.
But we love it. It's not. We have a. It's like a. It's a legacy. It's not a thing. It's yeah. So.
Probably there's a mix to this question. Probably a part business owner question, but also I guess a practitioner question. Is there people and patients you just wouldn't work with? Do you turn people away and go, we're not a good fit? And how do you do that?
It happens quickly.
Yeah. Do they do it or you do it?
Again, in the earlier days, I would turn myself inside out to change myself for them, do what they needed. Then I worked out there's some people that just are antagonistic or whatever, or maybe it's just we didn't get along. So now I've worked out that in that second visit, I say, this is what I do. If at any time this is not suiting you, please tell me, because I want to be able to say hello to you in the supermarket and not duck down another aisle, okay? I want you to still be able to say, hi, Leisha, how you going, whatever, because that's important to me. But I'm not going to compromise my care. I'm not going to compromise how I change it, because I have done that because I was trying to please somebody else. I was trying to do what they wanted me to do. And people in pain can be very aggressive. So in your early years, you have to, it's the whole care for the carer thing. You can take home some stuff and you're going, people can get a little angry, but they're not really angry at you, they're angry at the world, and it takes a while to work that out.
And pain causes some pretty funky
That's right. And
emotions.
so, but now you get more experience, and when you can say to someone, you go, God, pain's horrible, isn't it? And actually relate to saying, I know it feels terrible, and I'm going to walk through this with you, and let's just get on with it. Instead of, maybe even that changes for me because of being frightened, taking it personally, and now I don't take it personally. I go, I get it. Feeling sick is horrible. And I know you feel at the end of your tether, and I'm going to do the best I can to help you. And if I get to a point that I can't, I'll let you know. So now it's just like, you're feeling shit today, aren't you? Okay, all right, what do you want? Do you need me to step out for a while? Because now I'm more confident because it's experience. Again, you come and you say, look, it's okay. You're having a shit day, just have a drink, take a while to come in, whatever. Also, I have a wonderful staff. So this week I've had my head Sue, my right arm, my office manager, my everything, pull me aside and just say, someone's not travelling well today. I just want to let you know, whatever. So I get a bit of a heads up because we get to know our crew, our family, our clients, our people very, very well. And so I can just come in and put my hand on them and say, you're okay. Anything you want to tell me before we start? So I have a huge supportive team. I have someone in the room with me all the time. That really helps as well. It helps me not take on so much of the negative energy, and it gives me an out when I need it.
Is that also a safety thing? Like you've got a witness to things?
Well, I think so. And I have had people have those problems, usually male practitioners. I personally have not. I have had a couple of people over the years cross the line, but I've never felt sometimes I've just joked, hey, look, I'll take it as a compliment, but all good. Yeah. And I think the way you kind of react to it, country people are different as well. I think it's really, I think it'd be different. In a country, people are loyal. Everyone knows someone who knows someone else. So there is some safety in that as well. So
talk about this for a second. It's a very, my stomach's rumbling. It's a very intimate thing.
Yeah.
How do you cross? I'm not saying cross that line in a bad way. How do you, as a new practitioner, sort of go, I've got to touch people and I've got to touch them?
You tell them you're going to do it.
Yeah.
First up, so I'm just about to touch your tailbone. And also it's the way you come, the way you actually say it. If you go, look now, we just go, and also it's the way you touch too. So I'm actually writing a bit of a manual as I go as well, how to practice, how to be a chiropractor for the 6th year students, so the first year out. So touching with certain areas that you might be pubic bone, all right? You're not going to touch it with your hands this way. You'll touch, so there's little just obvious things that you do, or you say, I'm about to that, or you take their hand and you say, can you put your hand there? I'm just going to place my hand over the top of it. So you just do those things, and you learn over time how to do that. But also, just not going straight, you're going to go, all right, so this is connected to this. So I'm going to come down off here, and I'll be on your tailbone right here. Also, they've got clothes on, which really is, so that is helpful as well. There are some people that I'll put a towel over.
Yeah.
So even ladies, sometimes they haven't realised that they lay down their skirt goes way up.
Yeah.
So we put a towel over.
Yeah.
I encourage my son, who's now just graduated, I said, ladies, put a towel over them. It just, they feel much more comfortable just to have, it's something that, just a routine for him. I've said, put a towel over.
Do you think as a male practitioner, he's behind the eight ball a bit when it comes to that sort of thing, because there's
possibly
a preconceived notion?
Possibly. Well, I've only known friends that have had problems that you talk about that have been males.
Yeah.
So I guess we have to say that. But I still think it also is the way you enter the room, the relationship you made with them in the first and second visit as well.
I'll attest to that.
Yeah, so that's very important, how comfortable they are with you for a start. What's also happening within our world is not being in a single room. So you have multiple tables in quite a large room. So that really helps that as well. And that's actually where the technique that he's using is like that as well.
Yeah.
But very, very important about touch these days, even for teachers, about how the comforting students. There's a lot of this that everyone has to navigate as well.
What about, there's a lot more focus now on things like neurodivergent people and don't like touch. And like my daughter, just
I find a towel helps with that as well.
Cannot cope with it. Don't touch me.
Yep.
And even a hug. Her version of a hug is...
Yeah. And our two greyhounds, one of them, he's a bit autistic bluey, so he has his little space too. And so Pat's like... So I feel that also the towel, sometimes when I put that on them, until they get to know me, and also my touch is very direct because it's about releasing where those nerves are being caught. So once they've got the groove of what I do, they're actually, and then because we're calming their nervous system, they actually really blossom themselves. But the towel helps because it's like a constant touch on them. That's why weighted blankets work. So it's like a weighted blanket, so they're not having this pokey feel, you're having this nice constant feel that I do over the top. So you manage that as well. And we've learnt more to do that as it's become more prevalent in the last 5, 7, 10.
So if you had advice for someone who's looking to get into the profession, what's that one thing you would say to them?
Go and observe many different chiropractors. Chiropractors are very open to sharing the thing that we do. We want more people to know what we do. We want to share it. So if they're thinking about it, go and see what it is. Because they might be at risk of thinking it's like physio. They might risk... You don't know what they know, because a lot of people think, well, aren't you the same as them? Oh, you're like a physio. And, I still go, not really, but, so I would say go and observe. Go and observe. And I would ask them why, why, what's your exposure been? And go and I'd give them some names, they would be really open to you going to watch them work and have a coffee with them or a cup of tea, whatever is your groove, and spend some time with them, because chiropractors share their time openly and get to know what it is.
It's an interesting discussion, because certainly in the health and safety industry, there's a lot of robust discussion at the moment around qualifications and so forth. And, anyone can find a private RTO training provider or a TAFE or whatever, go to a Cert 4 in safety, and that's basically a baseline entry for some jobs. Likewise, you then go to diplomas, advanced diplomas, grad certs, all that sort of stuff. But the quality is chalk and cheese, and there's not necessarily any hands-on. Like a lot of people, I must admit I'm one of them. I would like to see it, for us, become almost like an apprenticeship. Like it's not just a theory-based thing. You just go and sit at night school in after work. You've actually got to spend time and do the stuff, get out on the floor, talk to people, talk, big thing, but observe, watch, all that sort of stuff, as opposed to just these textbooks. And I've certainly seen it over the years in jobs. I've worked with some managers, safety managers, and, you can pick straight out of uni and, you've got a great qualification, mate. Your qualification is 10 times higher than what mine is, but I've been doing this 15 years, champ. And here's my experience.
Absolutely.
How do we get that to gel?
And that's what you get by going and speaking to practitioners, which is my son who's just graduated, did a lot of that, and actually working. Yeah, so working in the rooms or getting a job with a chiropractor. So I usually take a gap year student, they work in the rooms with me. And
I look forward to that. Lambs to the slaughter.
And so they get to know actually what I'm doing and get to understand it. So go and work, take it if you're interested in it, go and work with one, go and talk to them. They're really open. And but it's books and actual doing, as you said, is very, very different. Very different.
And they both have their place. I'm not.
You can't do one without the other.
Correct. I'm not anti-qualifications and all that, but
it doesn't matter if you're a nurse, whether you're a surgeon, whether you learn how to be safe. You learn, and then you get in there and go, whoa, the human being. There's a whole nother lot. So you learn how to be safe. Well, you learn how to be a medical doctor first, and then we layer on our technical skills.
Many years ago, I used to lecture for the ambulance service, and it was during that time where they transitioned. So they had their own training college, and you basically came on. You were employed as the paramedic, and it was pretty much all on the job and in their own training college. And when I started doing it, they just transitioned to an outsourced model, so it was going through universities and that sort of stuff. So they stripped a lot of that hands-on and all that observer. So they came out with their 4 years of qualification, but their actual hands-on experience was like next to zero. Yeah, they went off and did placements and things like that where they could, but it was a very different qualification and a very different level of quality that was coming out. Very different.
Well, with nursing now, I said my sister's a nurse for 50 years, and it was all in the hospital. And then it went, they did backwards and forwards. But I mean, obviously still had the academic behind it. But then it sort of went mostly academic, then a little bit of hospital at the end, and now it's sort of swinging back a little bit more because you need that, what you get in that hands-on and making decisions on the spot. And it's very, very important. And actually seeing how what they're teaching you actually plays out is very different. And sometimes there's no way of knowing. You just got to start. You got to start.
Yeah.
Like my son's had his first day yesterday. Doing the thing.
And how's he finding it?
He's good. He's good. He's worked for 2 chiropractors as well. So that really helps. And also then running the front desk. So he's done the business side of it as well, he's done all those aspects. But you can never, that first day you stand in there and you all have a bit of an imposter syndrome, thing. Let's start.
Everyone has imposter.
That's right.
God, I don't know how many times I've talked about that with people over the years. Especially, I've become more aware of it even myself. I was terrible at times. What's the word? I can be really self-sabotaging at times. I think everyone does.
Absolutely.
And I'll just articulate it. And someone will go, what the hell are you saying that for? I think everyone goes through that. Absolutely. How important is things like mentoring, whether it's business, chiro, whatever it may be? How important has that been for you?
For me personally, whether it's a business, so most people who are elite at anything still have coaches. And I use Djokovic, as and all those Federers, whatever. There's always changing. I'm retired now, but
she likes the tennis, by the way. If you haven't picked up on that,
and a lot of people they can relate to that. So I say, do you think even the people of the top have people coaching them? Because that's the only way you get better. To look at it from another point of view. So that's why my junkets, as you call them, are going amongst those people. And
the last one was to Prague. Let's call it a junket.
So
I've never been to Prague for a conference, I must say.
Well, there's chiropractors in
I've been to Melbourne.
There's chiropractors over there. And so you get together and you go, you do it that way. Oh, I remember learning that 30 years ago. I'd forgotten that technique. And they go, well, I combine it with that one because I find when I do that. And then you go, oh. And so the longer you do it, you can come back with 2 things and you're happy because you're laying another thing and another thing and another thing. Yeah.
Do you, when you go to these things, do you occasionally come across that person who goes, vampire?
No, because they're all chiropractors.
And they're across it.
Yeah. Well, they're chiropractors as well. So, it depends. If we're doing a multidisciplinary seminar, so Yeah, they're interesting, those ones, if you're going along to, yeah, those ones. They're not my favourite ones. So you go along to the neurosurgeons one or the spine help or those sort of, and so you've got your surgeons and, yes, so it's a broad, it's interesting. It's not where I get my fuel, you know. It's where you pick up what is that area doing latest now, but they not really interested so much in what we've got to say. But, and you know, I used to take that personally, not so much now, because and it happened, that was another light bulb moment when my daughter had open heart surgery, which goes back to the Royal Children's Hospital, saving 2 of my children's lives. So when she was in intensive care, and you're watching the blip, she was 10, by the way, which we didn't find out that she had open heart surgery, needed it till she was age 10. And so, you know, when we're in that environment, it's very tense, and, you know, and I'm going, why is she that colour? I said, we haven't pumped all her blood back in yet. And I go, oh, you know. So in that intense moment, you know, and then I say to one of the nurses or whoever, I go, when can I give her fish oil and her supplements? And she was lovingly said, you can slap all the fish over you like once we go to her stable. And what dawned in my mind was they're living and working that life and death situation. So the fact that they're not terribly interested in omega-3s doesn't surprise me, because it's not their world. Yeah. That doesn't mean they're disrespecting me. Yeah. So when that clink in yourself, you're going, they're doing what they do beautifully well, and there's no disregard to me to say, give her whatever supplement you like and get her back on the ward, you know. And so we can marry well together what we do. So so I can understand why they're not terribly interested necessarily, or the orthopaedic surgeons or the whatever, local ones might not be terribly interested in the recent technique I found to do this, because they go, oh, these people that I've got enough people that I'm trying to deal with here. So I think sometimes that's why there isn't as much intermingling, because people are so fully busy in their world to try and keep up what's going on in their world, let alone reading what's new stuff going on in chiropractic. I'm not keeping up with the new heart medication either. So I think we're full, and that can make us a little bit, we don't blend as much as could do, to what I said, just put other things on the table before we go too intensively with surgery and drugs.
Yeah, for sure. A question, I want to jump back to business before we start to wind this up. That junket to Prague, you did something that not many business owners do. You didn't shut your business. You got another practitioner to come in and take over. Yeah. How hard was that to do?
Really hard.
And when did you start doing that?
Well, that's a really, really good question, because when I opened so I was an associate for someone for 11 years first. It's a very long associate, a very faithful associate. So that's when I had my 2 older children, and it was good to work for somebody else. I'm getting to your question.
No, that's fine.
So then I opened Readjust, and I said, and I took from my mentor, who was a lady that I worked for, I'm going to do what she does. She has 6 weeks off every year, and everyone knows she does it. I did it for 2 years. And I didn't have a good experience the second time. And I went, I've worked too hard to build what I have, and I got a fright because someone came in that didn't work with my people, and I put too much into it to do that. So I did what a lot of people do. I didn't have big holidays. I only had 2 weeks off a year, which I did close. I would close over Christmas because that was the most accepted thing to do. And people are away anyway, and I did close the business. So probably not a great business thing to do, but I do have a loyal clientele. So a lot of time they just say, well, wait till you're back. And so that's what I did for 23 years.
A long time.
And it was the only break I had.
But running a business is just easy. It's fun.
Well, adjusting people is, but then I noticed something, that I was getting this physical reaction when people talked about when they went, oh, they're going overseas. Oh, they're doing this. And I could feel it, and I was building a resentment, and then I was getting a bit stroppy, and that was rippling in many different directions, and I was building a resentment why, fantastic, I've built this wonderful business and whatever, but I have no freedom. So I started to feel a slave, which built resistance. I thought, well, what's the point? I started going, what is the
Pretty
point?
demotivating.
Yeah, although I get the joy. I never not loved doing what I do. So I wouldn't have done it for so long. I wouldn't have been able to do no holidays for 23 years without that. But I felt that I was starting to go, well, why?
But you can't do that without focusing on the back end of the business as well. And if you start resenting that, you've got issues. Yeah.
So then my son, who's the chiropractor, said he was working for another chiropractor who took on an associate. And he said, oh, you'd really love Dr. Sophie, you'd really love Dr. Sophie. And she's also from Bendigo. And then I met her at a seminar. We met face-to-face at the seminar. We got along really, really well. And I said, would you be interested in doing a locum for me? And she said, Leisha, that would be the biggest privilege if I could learn from you. And I went, oh, really? Okay.
Cool.
I've got something to offer. Okay.
There you go.
Yeah. And so it played both ways. She was happy to follow the script that I gave her. The other locum for me went off script, and it didn't work well, and doesn't mean they did the wrong thing, but it wasn't a fit for my practice. Whereas Sophie was wanting to learn from me, so she said, I'm happy to do what you do. If I can learn what you do, I'm happy. So I spent a lot of time helping her copy me from, which is also comes back to the manuscript that I'm writing.
Yep.
So now she's done 5 locums for me, and I go overseas twice a year.
I've noticed.
but
I haven't noticed a change in the care. Yeah, and I think that's really important.
But you've got to do the back end.
Yeah, absolutely.
Yeah, and that's not a financial back end. That's when I do this, we do this.
Yeah.
And do that, and don't go outside. And you don't, just these things I say don't do because that's too treacherous.
Yeah, absolutely. I remember when I was headhunted into this role with Safety Wise, and I talked to Jerry, the previous owner, and him and I were actually going on our way into Melbourne to go see a big, huge client. And we're just having a chat, and I'd only been there a couple of weeks, and I raised the question around KPIs and stuff. And I said, what's success look like? And he said, when people contact the business and don't even notice that I'm not there.
Yeah.
And I thought, I said, so don't KPI. I said, that's my KPI.
Yeah.
And that's really fascinating. And it took probably 18 months, maybe 2 years. And it stopped happening. People would stop asking for Jerry. Now, I don't even think people even know who Jerry is sometimes. And yet he developed the processes that we use and so forth. But I thought that's a really interesting. Yeah. People don't notice the difference.
Make yourself redundant. Whatever. But
it
still keeps going. So there's a script for that too. So most businesses have scripts for everything. And it's not wording scripty, but have a template. We do that and that, we do that and that. And an office manual is like, what do you do in this situation?
Yeah, absolutely. Before we get into the little bit of fun section for a second, if there was, I'm going to say 18 years old, doesn't matter. Let's say the person who's becoming an adult, if you could get into the year of every adult, what's the one advice you would give them?
Every year?
No, every year of every 18-year-old. What's the one advice you would give them? Does that make sense?
Yes, it does. I thought you said year.
Like, is it a preventative thing? What is it?
Oh, listen to your heart. What is it that moves you to tears or makes you so emotional? And follow that, because that's where your satisfaction in life is. Now, I will say chiropractic, we do personal development. That's a big part of our seminars. And that resonated with me as a 19, 20-year-old. And I guess that's why I pass it on, because that's what I heard. And you can pick up when there is something you go, I'm really interested in. What is it that moves you? What is it that makes you keep going? What are you reading about? Is it cooking? Is it this or that? Now, a lot of people say, I'm into that, but I can't make money out of that. And I go, well, just keep exploring it, because the better you become at that, you might be able to. So, and also, the world has moved increasingly towards, I'll do something to make money to.
Everyone's looking to make money. Isn't it fascinating, the shift? You get on Stalker Book or Facebook and everything is about, you can use AI, do this, you can do this, you can do this, you can do this, you can do this. Yeah, it's fascinating.
But increasingly then we have a look at the happy, some of the richest people, and not all of them tend to be that happy. I mean, so we go, but we're still looking to do that when that hasn't been the formula for happiness. And So it is, again, it always comes, people say it, but then they sort of forget it somewhere, doing stuff for others, and so find what it is that you feel that not only you're good at it, but that you think, you'll feel it. I feel good when I do that, and and then whatever it is, and then find out how you could be the best at that, or find someone else who's the best at that, and go and talk to them about that, and follow that path. Not the path necessarily, which is why my daughter's changed what she's done a few times, because she followed the path of you're the Ducks, and school captain said this is what you do, and so she followed the path of what they do, and she goes, it wasn't me at all, and followed the path of commerce because I'm good at numbers, because I ducked that, so everyone says you're good at numbers, I'll do that, and so that's why at 26, which doesn't matter, it doesn't matter when you find your thing. She said, I want to do chiropractic, but I want to do it with people with neurodivergent and on the autism spectrum, and because she's done psychology as well and can see how to marry beautiful. But no, but I guess that's her journey. So she followed where her passion was helping people, and thought she was going to do that in these other ways, but no, it was this way.
Yeah.
But so just follow your path. Keep following what feels right, and follow your heart. I mean, I know people say it, but or your gut instinct. Let's say it another way. If it doesn't feel right, maybe not. And then find people that are doing what you think you want to do. Talk to them. Yeah.
It's interesting. Many years ago, I, like everyone, had gone through multiple jobs at one stage. And one of the jobs I was doing was actually sales, and I thought it was a natural progression. I had really good success with this company. I'd been with them a number of years, and I was getting sales, but I wasn't a salesperson. And a sales position came up, and I thought, that's natural. I seem to be pretty good at this. It was shit. I hated it. Hated every bit of it. But what they did as part of that, they put us through a multi-day sales program, but that also included a thing called a Berkman assessment. And Berkman looks at the types of jobs you should be doing. And I still remember it. The people who facilitated that test pulled me aside at the end of this workshop and said, we're engaged by your employer. We shouldn't have this conversation with you, but you are in the wrong job. Your results tell us that you should be doing training. And literally overnight, I pivoted into training. And it was the greatest career thing I ever did. And then I always had a passion for safety. And where it got really cool is when I could combine safety with training. But it was also cool because I could go into a training job. Well, I'm sick of that now. I'll go into a safety job. But the funny thing is now, I consider nothing worse than sitting in front of a class now. I've sort of evolved again.
Yeah.
But I even remember, I'm going to say probably 15 or so years ago, having a conversation with my manager who became my mentor. We still stay in contact. And we talked about me going to a management role. I said, get stuffed. I'm not interested in that. Yeah. Now look at it. I'm the CEO of multiple businesses and haven't looked back. But it's funny, you've got to trust that.
But those stepping stones.
Yeah.
But those stepping stones lay the foundation.
Yeah, absolutely. Absolutely. I still remember that conversation with this company. Like, it was just a life-changing moment. I went, they're onto something. And they were right. I was already sort of tinkering a little bit in the background with some training stuff. And I went,
but you found that when you did it, I like it.
Yeah, absolutely.
Yeah, and then that's that thing that I think you go, where do you feel full in yourself? What is it, that thing that makes you feel full?
Yeah, absolutely. Yeah, it's important. Okay, rapid fire questions without thought. Coffee or tea?
Coffee.
No tea?
Tea with fruitcake.
How many coffees a day? Coffee is one thing I haven't been told to give up. Lucky.
How many coffees or how many shots?
Oh, here we go. Go on.
Either have 2 single shot espressos or 1 long black.
Okay.
Yeah.
Okay. All right. Are you a morning person or a night person?
Morning.
Yeah, okay. Yeah, I must admit I am too.
Yeah, morning.
And I won't deny it's not uncommon. Like, I'll wake up at 3 and I'll actually get up and do some work. And
you told me that.
Yeah, and I might go back to bed at 6 o'clock for an hour or two. Yeah. Joys of working for yourself and working from home. But
you do think your brain's doing different things at that 4:30. So a lot of CEOs like yourself, that's their brain time.
And there's no distractions. There's no phones. There's no Teams messages. I can just get in and get stuff
I used to study at that time.
Yeah.
Before my people in the house woke up.
Yeah, I love it. Like, sometimes you just wake up, the brain kicks in, and you go, have I got an idea?
Yeah.
I wrote a book last week.
Notepad beside bed.
I wrote a full book last week. We'll come back to that.
We did.
Yeah, we'll come back when we finish this.
Yeah.
Favourite food?
Steak.
Oh, go on. Okay. Yeah. How do you like your steak?
Medium rare.
Served with what? Mushy sauce? What are you?
Broccoli.
All right, we're done.
butter and a big slab of butter on
Oh,
the
that's
top.
okay.
Truffle butter. Truffle butter.
Oh, now we're getting fancy. Very first job ever.
Ever. So other than working for family, won't count that. Coles supermarket, fruit and veg chick.
Okay.
Yeah.
Okay. Cool.
Yeah.
How long did you do that?
From 14 and 8 months, whatever you were allowed to do, up until I didn't do it through year 12. So
How important do you think that sort of stuff was for you?
critical. All our kids have had, definitely, my dad said, you are going to learn how to take instruction.
Yeah.
Yeah.
I've got four kids. Two have taken apprenticeships, school-based apprenticeships, and I love that. It's fantastic. One's third-year mechanic, car mechanic, and the other one's literally just started a couple of months ago as a chef. And he's 16. Taylor started similar age with her mechanics as well. Like it's just.
How do you know the value of a dollar if you haven't had to earn it and earn it hard?
Yeah.
You know?
Yeah, absolutely. And I think apprenticeships are great.
Yep.
Yeah, absolutely. That's good. Interesting. Here we go. Favorite holiday destination.
Oh, well, look, my heart actually...
Where's the favourite you've been to?
Actually, my heart's going to have to say beach because I grew up having caravan holidays at Torquay. So that's actually the first thing that came into mind. This Europe travelling has only happened since 2023, so that's a new thing. But my heart is the beach.
So if time and money was not an issue, where's the one place you would absolutely love to go? If you could pack up tomorrow and just go for a holiday.
I still have to say Japan. I've been there
twice.
That's
on my bucket list.
Looks amazing. Been there twice with my youngest son, and because he's obsessed, it fills me spiritually.
Yeah, interesting. Yeah, okay.
As opposed to some European places, they're pretty and beautiful and they're gorgeous to look at, and their whole, sitting, all the things that we picture with the beautiful shopping, the beautiful whatever. Japan makes me relax, calms me.
I'm going to go back to the work thing for a second. I'm going to move away from the rapid fire for a second.
Yeah.
Could you take your business, for example, to Japan? Are they other cultures receptive to what you do? Oh, we're going to get heavy for a second.
Yes, and some more than others.
Yep.
And it depends on the technique you do.
Yep.
Again, so that will Italy, for instance, because one of the recent seminars I was in Italy, and I asked about working over there, and they said it's not registered properly yet. So anyone can call themselves a chiropractor.
So that's a bit scary.
A bit scary, yeah. So it is. So you could work there, but it may be different. There are people that do the technique that I've been learning in Europe. There are people doing that technique in Japan. So yes.
Okay, cool.
Yes.
Let's go back
so
to
the
rapid
answer is
fire.
yes.
Okay, cool. You have a nickname?
Mossy.
Mossy. Is there a backstory to that, or?
My maiden name's Amos.
Okay, that makes sense.
So, but I've never really it's never really stuck that much.
Yep, okay. What's something on your bucket list?
Wow. Isn't that funny? I haven't really thought about that much because this travelling and this independence is always on my bucket list and I've started to do it.
Yep.
So that's, for me, one of the biggest things. To not have have free time that hop on a plane and have no return ticket.
Where would you go?
I don't know.
Just
might be something else. To actually have I don't have to be anywhere. When you've run your own, getting back to what I said before, that slave to everything, that was the thing that was building. Yeah. And so when you say about a bucket list, it's saying, I don't have any responsibilities to anyone. I think responsibility comes back to being a mother, business owner. I think that's a thing. That's a thing. I'm sure men have it as well. But to be at a time where I actually don't have any responsibilities to anyone, and I'm going to hop on that plane. I'll come back whenever I feel like it. I don't know if that's achievable, but we'll see.
It's coming.
Yeah.
When you franchise out your clinic and favorite movie or TV show?
Favorite movie is a really hard one.
They are.
Everyone,
mine is so diverse.
Look, everyone loves Shawshank Redemption, don't they?
Yeah.
But there's another one that is our family movie, which is About Time. And it's our family movie. We went on a family date night and we went and saw About Time, and now it's something we at least watch when the adult kids come home. Their partners have to watch About Time, and it's our thing. So About Time is for that, and then Bridesmaids because it makes me laugh out loud every time, and I'm not comedy and me don't go. So something that makes me laugh, belly laugh, I like. So Bridesmaids.
Fair call.
Yeah.
What's your hidden talent?
Oh, it's not very hidden. I'm good at making things look good. So if I wasn't a chiropractor, as in aesthetics, colours, pulling stuff together to like interior decorating or those people's when they make over someone in a
Yeah.
So it was always girls' weekends. I go, bring Leisha, she'll tell you what she's wearing. If we base it on what she's wearing for the 4 days, we'll know. So I think picking colours straight away and going, no, that doesn't go with that. Why? No, I just know it's got a pink base, not an orange base. It's just not right. And really, it's just an automatic thing. It comes from mum. Yep.
Maybe chiropractic's amazing. Maybe it's colour coordination.
No. Too superficial.
What's one thing you can't live without?
Adjusting people. That's why I think
you've basically said that earlier.
That's why I think I say to people that, and I think my husband gets really because I call chiropractic the love of my life, and so even my children sometimes go, Mum. I even talk about that I'll drop dead adjusting people. Like I plan to actually be that. That's my oxygen.
I will share with everyone, Leisha did say to me a little while ago, we're having dinner with the family last night. We're talking about your digestion. Really? Really? Over dinner. Cool. Favourite book?
Perfume. And it'll freak you out when you, I should know the book Perfume, but it was my first book I read as an adult outside graduating, et cetera, that I read purely to read. And it has stuck with me, and I gave it to my son this Christmas. And it's quite gross, which people go, oh, gosh.
Is it about the perfume industry?
No, it's about a very troubled character who's a murderer. And it's quite, and I told a lady in town when I was wanting a book recommendation, she goes, tell me your favourite book. And I went, Perfume. She went, oof, you've got some grunt to you, don't you? And the other one
You've got some issues.
The Lion, the Witch and the Wardrobe.
Okay. Yep. All right.
That was the first book that I fell in love with reading when I was 13. Yeah. So that was on. I go, God, it doesn't have to be a chore.
I remember those. All the Narnia books. Same thing. I sort of grew up with those. And
I like the classics. I was in a book club for 9 years.
Yeah.
And I like the classics.
Yeah. Good.
Yeah.
I know the answer to this from what you've already said. Cats or dogs?
Dogs.
Yeah. You said that.
Yeah.
Did you say greyhounds?
Yes.
Are they rescues or?
But we've had Westies. We've had
rescues. Sorry.
Yes, yes, they are, and they're so perfect and beautiful. And I say that they were, in my mind, they were looked after well because they were the champions. So they won lots of races, and we've been involved in the racing industry, thoroughbreds. So I know how well they can be looked after if they're successful. So I think that my little greyhounds were really looked after well, and I decided that's how they were, and now we've put them in the paddock to enjoy their retirement.
We've had a couple of Great Danes and just amazing personalities. Dumb as dog shit sometimes, but personalities just cool as, and they're just big buffy things.
They're big buffy things. They are big buffy things.
Yeah, absolutely. What's your guilty pleasure snack?
It's it'd have to be a carb, and it's usually savoury. It's so basic. A glass of red and potato chips.
Okay. See, I don't drink, so I can't associate alcohol. I never have. At a bar, go figure. Yeah.
So I don't know, but
it's an interesting combination. Like
it is. People
I visualise like a can of Coke and chips, but
that's
not a wine.
Yeah. So and I go, it doesn't go together, and sometimes not very cool, not very. People say she was saying crayfish or whatever. And I go, no, it's potato chips.
Yeah.
And
nothing wrong with that.
Chips.
They're vegetable. They're healthy.
They're awesome. Yeah.
Yeah. You get them.
Cook them in good oil.
Or rubber banks. Come on, they're healthy.
Yeah.
Yeah, absolutely.
I do like fruitcake. I said that too.
You did.
I ate a whole fruitcake myself.
Yeah, I'm not a fruitcake person. I'm a bit of a fruitcake myself, but I'm not a fruitcake person.
Fruitcake, cup of tea, yeah.
What's a word that your friends and family would use to describe you?
loyal.
Cool.
And considered, loyal and considered. That's the one.
What's something you're currently learning?
How to do nothing. How to let go.
Yeah, so important. Especially we've had that conversation about business.
On a business perspective too.
Absolutely.
So my son was asking me about this because my bestest girlfriend, who's also a chiropractor, who's does a different technique that I was referring to earlier. We were just talking one day about a bank balance, a clinic, books or whatever, how are you doing this? And I said, I don't know, I haven't looked at that in about a month. And she looked at me. You haven't looked at the bank balance of the clinic for a month? And I said, well, no, I get it, whatever, but I've put people in place for that now. And that was for her. She goes, are you serious? I go, yeah, no. Yeah. So putting in place people, you do that, and then give me a report at the end of the month. Yeah.
I don't say it in a derogatory way, but I have said for many years now, why have a dog and bark yourself?
Exactly. It's not my skill.
Correct. And I remember when I came into Safety Wise, when 10 years ago, when Jerry approached me, I was very upfront the very first meeting. I said, I am not a finance person. Yeah, I can write a budget, I can manage a budget, that's fine, I can do that. But mate, if you want an accountant that's going to do three-way forecasts and everything, that's not me.
But it also gives you, sometimes people don't want to spend the money for that.
Yeah.
I think your business does need to get to a point that it's buoyant enough to do that.
Yeah.
But it gives you back so much more than the cost of that.
Yeah.
So for me to be able to have Fabulous Fun Day Friday and decide on a whim, am I going to go and sit in Castlemaine Park and read a book? Am I going to go to the paddle steamers in Echuca? Am I going to, because I don't have to do any of that stuff, is worth, and the kids say to me, Mum, we love this about you. Someone could pay me, there is not an amount someone could pay me for me not to have Fabulous Fun Day Friday.
Yeah, I like it. What's your go-to stress relief other than wine and chips?
Walking the dogs, being around the pets, being around the animals, nature, the beach, and being on my own. I actually think too, just the time out, just to sit and perhaps even write down what is bothering you. Up here, it's bigger than it actually is. So when you take it from here and write down, I'm worried about, you look at it and go, really? It looks different on paper.
Yep.
And so when I sit in a park or even sit in a cafe with my single shot espresso with hot water on the side, I can do that. And then I look at it and I go, you know what? Whatever that thing that was bothering you, when you put it there and actually work it through the way you would a maths equation, it's doable. That's good.
Yeah, cool. Last one. What's something that makes you laugh every time?
Bridesmaids.
Okay.
That's not an easy thing for me to do just because I'm very formal, I think. And so to laugh every time, just particular movie or, Bridesmaids. Stupid stuff.
Cool.
Thank you.
Thank you very much for your time.
Yeah.
That was really interesting, and I think even for me, as I said, I've been seeing you for a few months now, and it's been interesting to get that insight. I'm still not scared of it. It's been really interesting. Here's a chance. How do people contact you? Talk about the clinic for a minute.
Readjust Chiropractic Centre in Bendigo. Look up Dr. Leisha. Yeah, and there's not many readjusts around, and you'll see a thing of me adjusting someone. So when he says I do this and this and this, there's a YouTube video on there of me adjusting, and often that's what people see and they go, oh, she's not doing what I thought I saw on da-da-da. And,
Awesome. Thank you again. That was really enjoyable. And it was very different. I said I haven't done a health side of one before, so it's certainly different. Thank you. I hope everyone enjoyed it. Please, if you've got any comments, share them in our social posts about this podcast when it goes live. Hit the subscribe button. Always need subscribers. They're really important to us. Thanks everyone for your time.